there are still people coming in. We had quite a lot of interest in this topic, which is great. Hmm. So sorry for those who are going to hear this a few times, but as people are coming in, I'm just going to repeat that welcome, and we're just letting folks into the room before we get started. Feel free to type in your name and where you're located in the chat. It's always nice to see who's on the call, and we'll get going in just a minute or two. Thanks for being here. You're seeing a nice mix. Some folks up in the Kingdom, Rutland, Brattleboro, Upper Valley. Nice to have people from all over the state. Rutland City. I saw Craftsbury in there. That's great. Hmm. So given the time, I think we'll get started and people will kind of come in and join, but please feel free to continue to put in the chat your name and where you're joining from. So good morning, everyone. My name is Jenna Koloski. I am the Community Engagement and Policy Director for the Vermont Council on Rural Development. Thank you for being with us this morning. This is a workshop we've called Community Mental Health and Wellbeing. And it's part of our Vermont Community Leadership Network. So for those of you that are maybe new to this, the Community Leadership Network is a group of about 3,000 folks all over the state that are community volunteers, municipal leaders, state leaders, nonprofit, business, really a mix of people like all of you who are getting things done in their communities. And we actually started this network during kind of the peak of the pandemic, recognizing that there really was an opportunity to use technology available to us to connect people around the state, to support each other, to learn together in the work that we're doing, and also connect folks like you and others doing work in their communities to resources and best practices and strategies. So that's what this kind of grew out of. And now we tend to kind of offer workshops on topics that we see as important and relevant to work going on today. And then we also sometimes, bring folks together for just open conversations, and sometimes a little bit of both, which is the plan today. So um, they, our goal over the next kind of 6 months to a year here, as many of you may know, and some may not, we really kind of pivoted some of our programming here with the Leadership Network post flooding, just recognizing that some of the needs may have changed. We provided opportunities for kind of open discussions for folks that were responding to and working on recovery in their communities. And then we also held a series of workshops on relevant topics. Over the next few months, my goal is to really kind of hold workshops on topics that are universally relevant in all of our communities that we're seeing, but also could be helpful to focus on kind of post-flooding as well, as communities continue to recover and maybe think about rebuilding for the future. So this is one topic that in our community work, we've seen just coming up constantly, whether it's a community that was hit by the flooding or others around the state, just concerned about how they can better support the mental health and well-being of folks in their community. And I think more importantly, how to kind of do that at the community scale. There are certainly resources out there at the regional level, the state level, national resources, but I think a lot of folks wondering, how do we address this really challenging issue and maybe sensitive issue at the community level? So that's our goal today. We've got an excellent group of panelists that we wanted to bring to you all. The plan is to hear from our panelists first and then shift into questions and kind of open conversation toward the end, right around 11:10. We're going to shift into that. So hopefully you can stick around till 11:30. I'm going to just really quickly, a couple things I'll say up front. One, we are recording this session and we'll share it afterwards. So know that that will be available. We record and share all of our workshops on vtrural.org on our website. There's a whole library of past workshops, so feel free to explore those, and this will be uploaded, and then we'll also share both the recording and the notes in the chat with you all, any resources that emerge in the chat. So I just want you to know that that's going to be available to you. And I just do want to mention to our next workshop, and maybe I'll have Alyssa or Lauren plug in, because I don't know the date off the top of my head, but in January, we're kind of holding a skills-based workshop on Project Management 101 with Jenna Lopaczynski from Preservation Trust of Vermont. So check that out if that's useful to you. So we're going to be hearing from our panel shortly. I'll just kind of quickly run through just names and affiliations, but then I'm going to have each panelist actually introduce yourself and talk about how your work connects to this topic of community mental health and well-being. But the speakers that we have with us are, we have a special treat and a national speaker coming to us to share their work. We have Amy Carol Dominguez, the Program Director for Crisis Emotional Care Team for Vibrant Emotional Health. We have Heather Slayton and Jessica Kell joining us from Washington County Mental Health Services. Pam Wilson, who is working on an arts initiative project in Barre with youth in the city, and she can share more about that. Gary Rogers, the Recreation Superintendent for Burlington Parks and Recreation, and then Arwen Turner from Come Alive Outside, based down in Rutland. So thank you to our panelists for being here. The goal is to really kind of give you a range of perspectives on this topic, and then to hear from other folks on the call. So maybe starting out, I'll just call on each presenter just a couple minutes of a brief intro, kind of introducing yourself and a quick overview of either the kind of work that you do generally or the project that you're kind of focused on right now as it connects to this topic. Why don't we start with Amy? Do you want to say hello first?
Hey, everybody. Thank you so much for having me here today. A special thanks to Andy Barker over at the Community Foundation for the connection. Vibrant is most commonly known for our administration of 988, the National Suicide and Crisis Prevention Line. And we also administer several other support lines like the Disaster Distress Helpline, the Veterans Crisis Line. The program that I work in is a part of our Disaster Services program and department. Our Crisis Emotional Care Team is a cadre or a group of behavioral health providers that are across the nation, including in Vermont, who have a variety of backgrounds in behavioral health and have said that whenever a crisis or a situation occurs, they're willing to support. We typically provide support in really three areas: direct services, so partnering with organizations on the ground after a crisis has occurred, and providing care and support of those organizations that are in the community. We provide a robust list of trainings for staff and for leaders who are within the community, and this ranges from across sectors, so government, nonprofit, and private. And then we do consultations as well, helping organizations develop disaster plans that integrate behavioral health as a part of their consideration. So personally, I've been in this field for way longer than I care to admit. It's about 20 years, and have had the honor of organizing organizations and volunteers in responses across the world. And I'm just honored to be with you today.
Great. Thanks, Amy, for being here. Let's go to Heather and Jessica. Do you want to introduce yourselves and talk a little bit about your work?
Want me to go first, Heather?
Yeah, I guess I should have made it difficult on you to make that decision. Go for it, Jessica.
Good morning, everybody. I'm Jessica Kell. I'm the interim children's director at Washington County Mental Health Services and also their new chief of operations. Good to be here this morning. Thanks for the invitation. I think you all know what Washington County Mental Health generally does, but just as a reminder, we provide comprehensive community mental health services to Washington County residents and beyond. That is focused on adult and child mental health services, can be crisis services, psychiatry services, developmental disabilities services there. But we also provide other things like housing supports and employment supports, basically anything that contributes to just overall mental health and wellness that keeps people whole and engaged in their communities. I've been a provider, a clinical provider, a mental health clinician for 17 years. And I'm now doing mostly administration, which is wonderful, but certainly passionate about mental health care, especially in rural settings. Before coming to Vermont 2 years ago, I spent 10 years in Alaska, and so really understand the challenges of rural healthcare, but also the opportunities. And so I'm just looking forward to the panel discussion and some of the bright spots that we can share with you guys today. And then I'll turn it over to you, Heather.
Hi, I'm Heather Slayton, also with Washington County Mental Health. I have been here for 22 years. I'm currently the communications coordinator, but spent the majority of my time doing direct service work in employment, case management, housing, you name it, I've done it here just about. Primarily, my work outside of communication is in wellness programming, and that's for staff, the people we serve directly in-house, and in the community. I'm also part of the SOS Vermont Community Crisis Program team. And really just shout out to Andy Barker and the Vermont Community Foundation grant money, because the work that has allowed us to do both in-house and out in the community has been just phenomenal. Getting people housing, helping to replace things that they lost in the flood. It's just been amazing and helped us do such great work. So yeah, we're here to talk about all of the great things that we've been able to do that are wellness-based things for everybody, staff, clients, community members. It's just been great stuff. And
great.
Wellness is just all mental health is wellness-based. So
yeah,
good stuff.
Well, thanks, Heather. I definitely want to hear more about that initiative as we dive in. Let's go next to Gary. Do you want to say hello? And then we'll do Arwen and Pam next, just so you're ready.
Sure. Hello, I'm Gary Rogers. I'm the Recreation Superintendent for the City of Burlington Parks, Rec, and Waterfront Department. And I today would like to talk about a couple of outdoor recreation opportunities that the City of Burlington is working on to really focus on trying to get folks in the city who don't have the opportunity to get out into beautiful Vermont, the opportunity to get out into beautiful Vermont. The first is a VOREC grant. VOREC is the Vermont Outdoor Recreation Economic Collaboration. We're working with VOREC and other in a partnership with other Burlington organizations. And we have purchased 60 mountain bikes, mountain bike trailer, and a number of outdoor recreation, winter recreation gear, skis, snowshoes, the like, and a trailer for that as well. And we're launching programs not only to get Burlington folks outside, but also if you're looking, your community is looking to have a trailer on site with bikes, working with the community to get that to you as well. Similar to, if those of you who are familiar with Local Motion, they also have a similar program. We're working in concert with them because so many communities are looking to have bikes in their community for 2 weeks, 3 weeks at a time, 4 weeks at a time. So an opportunity to expand that program. And also just we recently hired an individual who is working on doing outreach to underserved populations in Burlington and connecting them with the outdoors, working closely with the Association of Africans Living in Vermont and Spectrum Services, and starting an outing club for teens here in Burlington and Winooski.
Great, thanks, Gary. And I'll just kind of own up to the fact that I'm excited Gary's here, because when I first put this workshop topic out into the world, I got quite a bit of feedback from folks saying, I hope you're going to have somebody talking about the connection between the outdoors and mental health and well-being. And I was like, That wasn't my plan, but yes, we probably should. So glad that Gary's here. And along those lines, also, we have Arwen from Come Alive Outside. Do you want to say hello?
Hi, everyone. I'm Arwen Turner, she, her pronouns from Come Alive Outside. I'm the executive director. What we do at Come Alive Outside is we are a nonprofit that connects people to outdoor experiences for health, wellness, and joy. Everything that we do is through collaboration. So we have over 100 partners in Rutland County, and then we have over 300 partners nationwide. We do program outside of Rutland and are always looking for new partners and places to partner with. And then some of our core programs that we have been doing for the last several years. I saw Bethany yawn on this call. Just a little shout out to Bethany for our most kind of infamous program, popular program, the Kids Passport. Bethany actually created that 6 or 7 years ago. But we have Kids Passports in every elementary school in Rutland County. We have just created an outdoor passport mobile app, which we are excited to share with other communities to make getting outdoors fun and exciting in your hyper-local environment. We have our Mile a Day program that's open for free to anyone in North America. And then we also have our NatureX programs, Green Street programs. And then every year we kind of change it up and do what people in our community are interested in doing, helping people find ways to connect outdoors that meet them where they're at. So some of our programs for the last couple of years, we've had some Jedi trails, some Wizards in the Park, and we are looking at what we're going to be doing next year based on what our community is asking for.
Wonderful. Thank you so much. And then Pam, I'll just say, as if Andy hasn't gotten enough shout outs already, Andy Barker, I asked for recommendations of really wanting to showcase kind of locally based initiatives that are looking to address and support mental health and well-being in the community. And Pam is working on something that Andy mentioned. And so we're excited to hear what you're working on, Pam. Oh, and you need to unmute really quick, guys.
There we go.
Yep, there you go.
Yeah, lots of gratitude to Andy and to the Vermont Community Foundation right now. My name is Pam Wilson. I live in Barre City, and I am coming to this workshop with 2 Barre City projects that I'm working on. One is I'm a board member of Barre Up, which is a long-term recovery group in Barre City. Long-term recovery groups, which if you have not heard this phrase yet, you will hear of it a lot throughout flood recovery, which is something that FEMA recommends being stood up in communities after disasters. Long-term recovery groups after larger national disaster recovery groups leave. Long-term recovery groups are often local groups that tend to be there for whatever's left, whatever unmet needs still exist on the ground. And the project that I'm working on with the Arts Council and Vermont Community Foundation and our local libraries initially grew out of starting to identify through Barre Up, what are we missing? So there was the obvious, we need to rebuild our homes. Our community, the built environment around us has been disconnected. Our roads were broken, our houses needed rebuilt, but also the need of, wow, the public spaces that we tend to rely on are not able to provide the same kinds of programming. Our teachers are really busy doing the kind of support, academic support and social support that our students need. Can we tap into the power of teaching artists in our communities to begin offering high quality programming so that the connections that started to be developed after the flood? One of the things we heard at Barre Up was, wow, I'm meeting my neighbors. Wow, I got together with people who I hadn't met before in this neighborhood, and we did something together, and it was wonderful. I felt so good about helping out. And so we didn't want to lose that as the weather got darker and colder. And so the teaching artists roster became a pool, and our local artists through Studio Place Arts became a pool that we drew from and said, could we invite you to offer high quality arts programming for youth and adults in the community so that we have something to do in these darker, colder in these darker, colder seasons. And so starting next week, we're going to ramp up community arts workshops located at the Aldrich Library and in a couple of other non-flood impacted public sites that so that we can stay in touch with each other and be doing meaningful work and creative pursuits through the darker, colder months and stay connected to each other. Thanks, Jenna.
Thank you, Pam. Really nice to have you. And I just want to appreciate all of the work that you and others have done on that Barre Up committee. It has been, I mean, it's a group of volunteers and it's been an incredible lift that you all have taken on and just been really impressive to see that evolve. So thank you for that. And looking forward to hearing more about it. So I want to kind of dive into some specific questions I have for each of the panelists. You all bring different and complementary perspectives. And Heather and Jessica, I kind of want to start with you in terms of like setting the context for the conversation. I feel like you all kind of have a really nice comprehensive glimpse into like, what does it mean to have strong community mental health and well-being? What are the kind of factors that go into that? And I'd be interested to hear, like today, the challenges that you're seeing that communities face, and maybe potentially some bright spots that you're seeing, but just kind of the lay of the land. Like, what are you seeing and what does it mean to you, this term of community mental health? And Jess, you came off mute first, so I'll go to you first. I would love to hear Heather's reflections too.
Heather, I'm going to talk more about like my bigger picture idea, and I'll let you get into some of the nitty-gritty stuff that we're doing, Wellness Wednesdays, all that stuff. Does that sound good? Yeah, okay. I was driving in this morning, I was thinking about the question, and something that I wanted to lead with is how far mental health care has come, not just in the last 100 years, but even in the last 20 years since I went to grad school and then got licensed as a provider. The biggest step forward that I think we've made in community mental health is realizing that we all have something that's called mental health, and that it's not just some people in a sanatorium somewhere outside the city where people get tucked away and where family members don't talk about them and we never see them again. But mental health is part of our body and our community and our families and our schools and everything that we do. I would say 20 years ago, even that idea wasn't being taught to me in my graduate program in the way that it's being talked about now, the way that public media and social media talks about it frequently, where we are inviting people with lived experience to join our agencies, to provide services, to be peers, and to support others because they are maybe just at an earlier step in the journey. And so I think that community mental health is reflecting that it's something that belongs to us. It's not something that's necessarily done to us or fixed in us, but it's something that we do together. And so there are, of course, the clinical components, and Washington County Mental Health Services is one of those clinical components that delivers, these services to our communities that are a huge part of community wellness and mental health. But I think the paradigm is shifting, and we are owning wellness and mental health in a new way and talking about it in ways that make it more normal than it's ever been. And so there's actually, I think, lesser talk about destigmatizing, because I think we've made a lot of progress in that area. Right now, we're looking more about what is every person's responsibility to themselves and to one another. And so I just thought I would start there. I think the other thing is community mental health is when we address it, when we talk about it, when we do things to address it, it works. The outcomes are there. We see results. People connect. Doors are open, people are smiling, people know each other's names, people have resources that they freely share. We come up with creative ideas, the juices start flowing, the things just start gelling in a way that maybe they didn't before. And so I think we talked about that, right, at the Barre Up events. It's probably the most prominent thing that stuck with me is almost anything anybody was willing to contribute worked in some way for someone. And that was the magic, right? It wasn't FEMA's big idea. It wasn't one big solution. It wasn't a ton of money that just poured into the streets. It was everybody bringing their piece and making that, stone soup, right? Money can only take us so far. Brilliant ideas can only take us so far. It's when our community is alive and responsive to one another, that things start connecting. And I would even say it's when the person living next door comes over and talks for a moment or lends something or helps with something, not even 2 streets down or 5 blocks down or the next community over. It's literally when people find courage and opportunity to connect and then do that in their like smaller circles, that things start happening. And then I think the other thing that we took away from Barre Up conversations and that we are learning in mental health is, again, back to this bigger picture. It's not what a system of care prescribes to a community. Mental health and well-being is something that is a unique, individualized experience, and everybody defines that differently and needs something differently. And that's why it's so important that when we get together and we talk about what is this going to look like in our community, that we're literally talking about it from our perspective and from our connection to the very next person that is nearest to us. That's how it doesn't get abstract. And that's how interventions and ideas and solutions come to life that are incredibly practical. And so if there's anything that I could say is in the next 20 years, in my position, I want to keep seeing mental health solutions come about that are so practical and so tangible that they genuinely feel like they're owned by the whole community, and that nobody at any point can come up and say, well, actually, I came up with that idea, or it's actually the system of care idea that we, heard about nationally from XYZ speaker. It should be something that's so organically part of how we do life together that it feels like it's just a natural extension of, every neighborhood, street, corner, and relationship that we have with each other. So that was kind of the big idea. Heather, if you want to get into some of the nitty-gritty stuff in terms of what does that look like? What is Washington County mental health doing right now from where we sit? I think we've got some great projects happening.
It's hard to follow that, but yeah. We do have some great stuff happening. Lots of good stuff in the community right now. I'll start with Wellness Wednesday because today is the last Wednesday in the series. So if anybody wants to come check it out, today's it, from 4:30 to 7. So at our WellSpace building at 23 Summer Street in Barre, we hold 6-week sessions a couple of times a year of Wellness Wednesday, where anybody in the community can come get no cost, grant funded wellness. And when I say grant funded, it's because we get tiny grants from community partners who value community wellness. So local businesses will send us $1,000 or $2,000 at a time, and we have a few of them doing it every session. You can get AcuDetox, Reiki, sound healing, different types of massage, mindfulness meditation, and it's all local practitioners that come together for a measly little stipend, but mostly because they're very invested in community-based wellness. And we are there for 3 hours a night on Wednesdays, and literally anybody, community members, clients, staff, anybody can come in and book these sessions. You can just walk in for that ear AcuDetox and mindfulness meditation, or you can schedule any of the other services. we have tea and snacks and the lights are low and everybody sits in a zero gravity chair and just chills. So it's a great break from whatever you have going on in life, and it's consistent and just an awesome crew. We are currently also offering the flood crisis counseling during these sessions. So it is heavily advertised. Everybody loves it that comes through. We actually just presented on this at the DMH conference in Killington. So from this, we've been doing it for almost 2 years now. From this was born a new program in the community where we have started going into the schools and doing this with students locally throughout the county and in parts of Orange County, which we also serve. That turned into also doing it for school staff on their staff development days. So now we're doing student wellness and school staff wellness in the community as well. So that has been pretty amazing. So this just keeps expanding into other things. Another great thing that we do out of the same wealth space building in Barre is, in order to eliminate some of the wait list issues that we've been seeing for a couple of years now, in order to be able to generate a contact for kiddos, is we've created some groups. So while you're sitting around waiting for maybe a one-on-one therapy type of deal, we have groups that kids can come in once a week. They run for sessions of 6 or 10 weeks at a time. And just to get some hands-on contact with kids in similar situations, maybe. We have gym groups, we have art groups, we have photography groups, we have cooking groups, and parents can drop off or hang out in a different space in the building while their kids are engaging in some type of activity where they're not sitting at home or worse and just brooding or worrying or engaging in some dangerous behavior somewhere. And these are for different age groups, but they're grouped appropriately. So that's all really, really good stuff. We've got groups that are going out now into different flood affected places. So we're doing a lot of door-to-door outreach as part of our flood work. And we're sharing all the wellness activity information that we're doing as we're doing door-to-door outreach throughout the county and in parts of Orange County. And we're seeing a lot of those people coming in for things like Wellness Wednesday and in for groups. We recently held a joy table at the gardens in Williamstown. So they were doing a flood fundraiser, bake sale, silent auction kind of thing. And we went down and put together these really cute little mugs with some goodies in them and just handed out cups of joy. And that has resulted in some group support, not counseling, but just kind of group support group kind of leadership for them. And then again, those Vermont Community Foundation funds are going to allow us to help those residents who have been displaced from the gardens replace some of their belongings. So they're very appreciative and very excited about that. So once they've finally been able to rebuild their spaces, we'll be able to help them get back into them. We also have a new program right now called the Access Hub, which is open and cost-free to the entire community. And that is a pre-crisis program to avert crisis from the emergency department. And anybody can call or walk right into that. And it is about helping people find wellness without having to hit the emergency department. So if you need substance counseling, if you need some med management, if you need a meal, or a shower or a nap, you can walk in and you can find nursing, you can find a therapist, you can find anything that you need, and hopefully not end up in the ED with a screener. And that is completely open to the entire community. So lots of work in the community happening.
Yeah, thanks so much, Heather. And I do wonder, just really quick before we move on, I do, I think it's important to say that while you are serving Washington and it sounds like Orange County as well, there are organizations like yours serving every region of the state, correct?
Yes.
Yeah. And so I maybe there is a way to kind of share where folks can, for those of you that this may be new, could maybe find your local organization and maybe connect around this. So I just wanted to be sure to mention that. Amy, I'd love to come to you next. Specifically, given what Vermont has kind of been through with the flooding recently and your expertise, I'm curious to hear kind of a similar question that I asked to Heather and Jessica, like, what do you see in communities kind of post-disaster, post-crisis in particular, and kind of what you see as kind of helpful and how communities are able to kind of move forward from those challenges?
Thanks for the question, Jenna. So one of the things that Jessica said that I just want to hold is every community, every town, every person is unique. And so when we are training our cadre, the thing that we often say is how critical it is to be human first, not to necessarily don the hat of your professional credentialing or your agenda or treatment process, but to see somebody as a fellow human. And that can be expanded out into the different levels of community and any kind of systematic implementation. There is a lot of research, though, around the phases of disaster, expectations around what a community can, anticipate. I'm going to put a link in the chat for you all just to interact with on your own time. Since many of you might be familiar with the SAMHSA model of disasters, where it looks a lot like a wave, where you have the initial impact of the disaster, and then there's expectations about what resilience looks like over the course of time. And when the pandemic became part of our reality, our team began to think about how important it is to not look at one isolated incident necessarily, but to zoom out and look at the experience of a community, of a people group, of a organization, not just in the context of a flood, which there's in the actual acute phase, there's like a beginning, and then the flooding ends, and then you move into what we call recovery. But because all of us are impacted by multiple experiences in our lives, it's important to take that into consideration when considering a community's ability to recover. Within that, we also have done I've had a little bit of conversation around the word resilience. And we often find that word is used incorrectly to infer back to normal or back to what was. And that isn't actually the term at all. It's meant to instill a sense of, where do we go from here? How can we go forward stronger? Acknowledging where we are, acknowledging the realities that we're facing, and begin to build support, creative moments like Heather was talking about in these. I love that Wellness Wednesday concept. It's just so beautiful. But what kind of strategies can we put in place that allow for a community to heal? And when we're talking about that initial crisis intervention and that initial sense of finding our bearings, we look at what we call the core four. And those four pieces of one's individual experience are really good indicators as to where people are at in their kind of re-regulating after that initial phase. So it's sleep, is appetite, and is moving your body. And then, of course, the most important, which, Jessica, you acknowledged, is that social support. So that person right next to you. And we've actually found, the research has shown that when a person does lean into their social circle, whatever that might look like, we see a decrease in symptoms of post-traumatic stress and decrease of symptoms of trauma. And that is so when we're talking about, when you're thinking about designing programs and putting things together that have long-standing impacts in community healing, consider those four pieces. What kind of programs are we instilling that do allow people to connect, to memorialize the events, to, we have holidays coming up, and how do people who have lost loved ones navigate those very difficult, typically very, celebratory times? So it's technical in the sense that governments and organizations, there's systems in place to execute things, but it is incredibly human in the design of these programs. And I think a lot of times, and this is why I've so enjoyed working with, just connecting with Andy, frankly, around this, is that you have within Vermont such a sense of community and such a sense of connection to one another, that small town feel that New Englanders love, right? Like, that is a strength that you can hone and deploy for longer term support. And this model that I sent through, it's evidence informed and research based. It can give you some sense of who are the players in recovery. We talk about these different phases of anticipation, impact, adaptation, growth, and recovery, but it's important to remember that although we operate in linear mentalities often, it's much more cyclical, and to recognize that something small may send somebody back into a place of adaptation when they've been in a place of growth and recovery previously. And the duration and intensity of every phase, it really is dependent on the nature of the disaster, the dynamics of the community, the levels of loss. So I think I'll leave it there, but I would just encourage you to take a look at that link. It's a framework to interact with, but really remembering how important it is to see the human being and be the human being when designing these initiatives.
Thanks, Amy. I'm just, as you're talking, I'm scrolling through this page, and I just do want to encourage folks to kind of scroll down and take a look. Like, there's some really practical advice. Like, I'm looking at this key actions to adaptive mitigation of stress, and looking at like the different kind of types of folks involved in disaster: survivors, community leaders, responders, and kind of the different ways to provide support that meets those varying needs. It to me a really helpful framework. So just encourage people to take a look at that. And can you just I thought another really helpful thing you shared was around like focusing work on those 4 areas. Could you just repeat the 4? I think that would be helpful to hear again.
So it is, we call it the core 4, and then I'd be happy to follow up with a link to a video we put together. It's like 90 seconds about this, but regulated sleep, physical movement, eating, and physical health, and that appetite is what we call it, and then social support, and really, again, the focus of the impact of those 4 things. And I wanted to say one thing, if I can. You guys are moving into this adaptation to growth recovery phase from the flooding. And we've mapped out some things to expect of community members and of leaders during this time. And I think it is really important to acknowledge, especially folks who have been active in the immediate impact phase of helping people recover and helping getting the food and the water and the access to medical care and any that kind of intense moment. There is a lot of disorientation that begins to happen when you move into adaptation and growth and recovery as a responder or as a support, because you had this heightened sense of purpose and execution when caring for people in those acute moments. it can be incredibly disorienting to no longer have that. So that's why I would just encourage, if I can give one piece of practical advice to anybody who's been involved on the front lines or continuing to deal with folks who are struggling with the loss of loved ones or homes, make sure you're debriefing with one another and that you are taking moments to honor the victories that you have accomplished. I spoke with somebody in Maine last week who they put together a remarkable response plan to the horrific event of the shooting that I'm sure all of you've heard of. These two women organized this whole response. It was a need for about, I think it was 42 hours. And then things began to kind of return back to normal, so to speak, in terms of their specific activities. And they were completely at a loss because nobody had said, hey, you did an amazing thing in that moment. Like, it's going to be hard, but let's just take 30 seconds to acknowledge what you as a person were able to do for countless lives. And it's just, so I'd encourage you, because, my mother hen moment of people in this field, like take the time to honor what you've accomplished in this and keep doing it for each other and for your teams. So
thanks so much, Amy. Appreciate that. So I kind of, we've got about 20 minutes left here before I want to turn to questions. And I think for Gary and Arwen and Pam, like, my interest here is kind of to take it from this kind of bigger conversation to the community level and kind of hear, with your specific initiatives and projects in the communities that you serve and where you work, what are you seeing as the kind of impact of the programming you're doing? What do you hope for in terms of impact and how it connects to mental health and well-being? And just want to say, like, really neat to see how all three of your work fits into those core four that Amy mentioned. So maybe Pam, why don't we start with you and kind of hear from each of you, and then we'll turn it to questions from the group. Go ahead, Pam.
Yeah, thank you. Well, I have had the pleasure of being with Jessica and Heather at the Barre Up space and overlapping and kind of listening to how they've been shifting ideas about clinical care to this model of community wellness. And I love this. So my background is I'm a studio artist. I've been working in traditional handcraft from the time I was a little kid. And so that's always been in the background of my life. I'm also a clinical mental health provider. That's not, I retired from my private practice after a fair amount of COVID burnout and telemedicine about a year and a half ago. And part of the learning curve for me over COVID was, wow, everything I'm doing in this clinical services I'm providing, it's powerful, but if I can get somebody to do something, to take on a skill, to learn something new, to get outside, to move their body, to be in the presence of others, to do something altruistic, to volunteer, all of a sudden, whatever I'm doing in our therapy together just gets amplified. So in terms of figuring out, like, is there some kind of secret sauce that I can bring to community mental health or wellness? It tends to be this, can I get you doing something? Playing the piano, getting your cross-country skis out. And I am not a super outdoorsy person. I will not ride a mountain bike. I do not want to break my wrists. I have spent too much money investing in these hands as a hand worker and an artist. But what I can do is I am a great teacher and holder of space for doing handwork. And so when I started realizing my degree of COVID burnout, and also as a part-time provider, just the small number of people I was able to help over the course of a week, I shifted over into thinking about, wow, what does it look like to make a really low bar for entry program for folks to be able to do handwork, this stuff that crosses the midline of the body, the stuff that is emotionally regulating. And when we make stuff, we then have this opportunity to like think about what we're making to give to other people. Often in the classes and the workshops that I'm leading, we're thinking about make something for yourself, get your own needs met, make something for someone else. What is your power to imagine what somebody else might be thinking or might need and make something special for them? And then do you have like a marketable skill that could shift into this? Can you make something to buy? And that people could buy, or that has economic power? And this is, I often work with youth and like taking them through those steps of, like, once their needs are met, they can start thinking about others, and then they can start thinking about themselves as kind of powerful agents in the world. And those things combined, I think for me, that space of like, wow, in terms of my community mental health impact, shifting over into being an artist who is doing teaching artist residencies and making arts activities really accessible. So what that means right now in Barre is they've got to be free, they've got to be high quality, you've got to be able to get to them easily. If it's a tool, we've got to be able to give you the tool, because we can't take for granted that somebody has access to it. Like knitting needles. Leslie Roth will be coming and doing some fiber circles at the Aldrich Library. We can't take for granted that people have their needles and their yarn anymore because of the flood. So making it as easy as possible for people to step into these activities. And then in the presence of those activities, we see them grow, and then we see them connect with others. And that social support and moving that Amy was talking about with outside hiking, mountain biking activities. I love the way people are moving their bodies, but also in just tiny little bits of handwork, we're still like crossing the midline of the body. If we're working with clay, we're still doing this like pounding back and forth. We're lifting, we're getting all that good stuff. So that's that amplifying effect of like getting people together, making it as easy as possible for them to do expressive activities is where that's the focus right now with the arts workshops that we're ramping up in Barre.
Great, thanks so much, Pam. Let's go, Gary, do you want to go next, and then Arwen to kind of share some of the impacts that you're seeing or hoping for, and how that connects to the mental health and well-being of the community?
Sure. So I want to start with an anecdote that really struck me early in my career. I put together a AAU basketball program for kids in Burlington who couldn't afford to play AAU basketball. It's expensive. We had some kids who were really good players who were playing on other AAU teams, but they never really stuck because they felt like they were off on their own. A lot of these kids were new to this country. And so we put a program together just for Burlington kids. So one of the teams that I coached, I used the city vehicle, and we did tournaments all over the state of Vermont. And I had mostly kids who were new to this country on these trips. And wherever we went anywhere to play a basketball tournament, all they wanted to do was see a deer. Like I drive on side roads and stuff to just so that they could see some natural things like an animal in the woods. And it really struck me that that there's many families in the city that aren't getting out of the city. So one of the things that is an initiative we do every summer is for all of our camps and our programs, we lease 2 full-size school buses and hire school bus drivers who are off for the summer. And every program has a field trip aspect to it to try to get kids in Burlington outside the city. And so I really feel like that's just an important thing to be able to experience something outside of your normal everyday experience. And so that's one piece. Another thing I would say is that as far as the adults in our community coming out of COVID, it seems like people really are chomping at the bit to do things and to get together with each other. We put together a Halloween event for adults. We'd never done it before. This was the second year that we did it. It's called Mystical Market. We do it at our biggest park, Oak Ledge Park, which has a big shelter. And it's new age vendors and palm readers. And Foam did alcohol. So we had this for adults, right? We had food trucks. And the first year we didn't know what to expect. Like, who knows, right? It was coming out of COVID. We had about 800 people. This year we had over 1,000, right? So it really is, it's feeling like out of COVID, people are looking to connect. And how can we as a community, how can our department with events and programs make that connection? So that's what I would say, that's our goal. And that's really trying to find ways to connect community And it could be something as specific as, I mean, I didn't know that the New Age community in Burlington area would be so receptive of having, you know, an event just for them, right? And so everything that in this business, it's eye-opening when you throw something against the wall and it does stick. Like, wow.
Thanks, Gary. Just a quick follow-up question for you. Like, it does seem, you know, I just want to make sure I'm correct. And yes, you're the only representative here that it kind of represents municipal government. And I'm just curious, like, it sounds to me like you're saying that there's been some kind of partnerships that have been important. Like, I'm curious just to elaborate on that a little bit, like what partnerships have been valuable to you in this work, and
Sure.
and kind of how you'd encourage folks on this call to reach out to their maybe municipal leaders or recreation departments, and kind of what approach to take. Any advice you have there?
Well, municipal government in general, and certainly Parks and Rec and waterfront departments, or we're waterfront, but mostly Parks and Rec departments. In this industry, we are open, and there are people on this call who I've partnered with, Andy being one of them, to do City Lake Semester, which is a BHS high school program that takes place at the Old North End Community Center, still going strong. If you're an organization in your community and you come to municipal government, chances are you're going to get a positive experience. One of our biggest partnerships is with the school district, and it's with the Burlington School Food Project. Burlington is a community that qualifies for free and reduced lunch universally, because over 50% of the kids in our school district qualify for free and reduced lunch. That means in the summertime, we can serve, the school department can serve meals to any youth under the age of 18 at no charge, and get reimbursed by the federal government. So we serve between 12 and 13. This last year, we served about 12,000 free meals in different settings. We have a recreation nutrition program, which is at 5 different sites throughout the city in subsidized housing complexes. And we actually bring activities to those kids and to those families, and it's all surrounded by the meal. There's a learning garden that we have, so that the kids, we take them on field trips to learning garden twice a week to learn about this is how we grow food, right? So work with your local school departments. That certainly is a first step. We're really lucky in Burlington that we have so many family and youth serving organizations. Partnerships with the Boys and Girls Club and King Street Youth Center, Sarah Holbrook. We're working really closely with AALV. One of our biggest recreation centers shares the Old North End Community Center with AALV, and that connection, we feel so important that we changed one of our full-time positions, a recreation specialist position, to specifically work with underserved populations and getting them involved with outdoor education and outdoor recreation. So those are a few of the partnerships, but I mean, there's many. The Burlington Housing Association and Champlain Housing Trust are fantastic with us. We do programming in both of their subsidized housing complexes throughout the city, and can't be more welcoming, writing grants for us, finding money for us. So my suggestion to folks would be reach out to your local municipal government, because more than likely they are going to want to help.
Great. Thanks, Gary. Arwen, we'd love to hear more about your work, and I'm sure you could probably share some reflections on partnership as well, and maybe you have kind of the other perspective on partnering with new municipality or other community orgs. But in general, kind of what you're seeing in terms of impact, or what you hope for with your work.
Yeah, and I'm like, the whole time Gary was talking, I was like, yeah, partners. Partners are everything for us in the work that we do. I think what we have seen Come Alive Outside, and the rec is one of our number one partners, but we really are partnering with anyone and everyone that wants to partner, and then really being specific about partnering with the folks who have lived experience or represent organizations that are underserved in the outdoors, which are also the same populations that face the highest health inequities. I think we all know that in this group. It's also no surprise. I don't think that anyone here is like, wow, getting outside is good for your mental health. Like, what a novel idea. We all know that. People all know that. But it's about what is going to get folks to feel like they are invited and part of that. And, Pam, you had said, like, you're not an outdoorsy person. We believe here at Come Alive Outside, to be outdoorsy, you just have to go outside like that. But that is kind of that misconception, I think, or just like you think about like maybe this like, Patagonia model on top of Mount Everest when you think of outdoorsy. But there's so many different ways that the outdoors can have a positive effect on mental health. And so that's what we try to do in our programming. We do measure increase in physical activity, time spent outdoors, and increase in mental well-being with our core programs. And across the board, those who do participate in our passport programs, Mile a Day and NatureRx, we're seeing 90 percentile of those numbers. But where we have fallen short and what we've been reflecting on and trying to really address over the last couple of years is how do we get those folks who don't have the self-efficacy or don't feel included or have barriers to go into those programs. And so we did a survey 2 years ago looking at who felt like they weren't included in the outdoors and why. And so what we've been doing for the past 2 years, thanks to funding from, we were able to get the Equity Track 2 funding, is 75% of our staff time is spent boots on the ground, working with partners and finding ways that those barriers can be addressed locally and not having us go in and just do everything because we don't want to take away from the great work that other organizations are doing. So with partnerships, some of the examples that I can think of, and these might seem silly, but everything that our entry to our programs is joy. But things like we would host group walks because the barrier was people didn't feel safe walking alone outside. So we'd host a group walk, no one would show up. So we put out a survey to our partners and on Facebook saying, what kind of group walks would you like to see in Rutland City? And what we had come back from that was, we want ghost walks like they have in Burlington. We want historic walks. And so what we ended up doing was we collected stories from the community and we've started urban legend walks. So where we had one person maybe sign up for those group walks before, we have 20 to 40 people at every single urban legend walk. It's a 1 mile accessible path. We go at the pace of the group. So if we can tell that some people are struggling, we just shorten it. And we continue to grow on those stories from people who share their stories on those walks. And so we have people coming back. And the other kind of things that we've been doing, finding people who didn't feel like they were comfortable going in the outdoors with their families because they weren't outdoorsy, but they were into things like Star Wars and pop culture. So once a year, we hide 1,000 baby Grogus or baby Yodas on the trails, and we have the Star Wars characters come out. And then families go through and adults. And if you find a Grogu, you may keep him. And we get 500 people at those events. And then they go back to the trails. So we're seeing with these outreach events that are just really, really focused in joy, that are addressing the needs and done in partnership with organizations that people already feel like they trust and know because they have shared lived experience with. We have an 85% retention rate of people that go to those events that then enter into our other programs. So I think my takeaway from all of this is we don't know everything as an individual organization, and our partners know our community and the folks with lived experience that we're not reaching. So as much as we can take the time and partner and kind of think outside the box and learn and unlearn, the more we can do.
Great. Thanks so much, Arwen. So we've got about 20 minutes left. I have a couple more questions I can certainly kind of continue on, but I do want to take some time to open it up to the group here. I would welcome questions or reactions or, reflections on what you're seeing in your own communities or in your own work. And panelists, I'd love to kind of just keep you all on hand to respond and reflect on what we're hearing from the group. If you want to chime in, Marty here is setting a good example by raising your hand on Zoom. So you can, if you use the raise hand function on Zoom, that's great. You can also come on camera and kind of wave physically so I can see you. Or if you're not getting through, just feel free to unmute and chime in. But let's start with Marty. Did you have a question or a thought that you wanted to share?
I do have a question. My name is Marty Gallagher. I'm the administrative director of Greater Rockingham Area Services in Bellows Falls. We maintain the buildings and grounds for the health center here. So we have primary care health. We have HCRS as one of our tenants, Wyndham Center, which is a 10 bed inpatient mental health unit. We have a new tenant, Frontline Foundations. They work with first responders that have PTSD. They do a resiliency program. And I have a fairly large space that has been vacated. And I had a spark of an idea to somehow, because our mission is to provide service, to provide a space within the town for services to the community, mental health and social services and physical health services. I had a spark of an idea of somehow recreating that space. It was previously a dental office, recreating that space into some form of something for mental health within the community. I've read a little bit about the idea of mental health emergency rooms, crisis centers. It's a really well designed space for something like that. I'm asking for guidance for anybody, any of the experts here on what would be my next steps. Who would I talk to? What partners would I involve? How might I find funding to do? There are some renovations that would need to be done to make it what it would need to be for whatever it ends up being.
Thanks, Marty. That's a wonderful idea. I don't know if maybe we'll start with panelists to see if you have any thoughts or advice for Marty, but would certainly welcome others on the call to chime in as well. Any of our panelists have something to share, ideas for Marty or resources that you would point her to?
I'll just say that one of the types of programs that we've seen, I'm sure you all are familiar with the concept of a family assistance center, which is often stood up by FEMA in kind of the immediate, or the State Department, sorry, in the immediate aftermath of an event. But we have seen in a few states like Colorado and others where they've taken the kind of that immediate approach and built it out for longer term. So providing crisis counseling. I would even encourage maybe some collaboration around like wellness resources. And I do know that like state governments do have resources for something like that. It might even be worth reaching out to SAMHSA, the Substance Abuse Mental Health Services Agency. They tend to have pockets of funding for these kinds of programs. So for what it's worth.
Okay, thank you.
Thanks, Amy. Heather, go ahead.
It sounds to me like you want to create something that's similar to our Access Hub, which is the crisis diversion program. Yeah. Okay. I can't really tell you where to go or how to start, but I could put you in contact with our ICS director.
Okay.
And because that is who created ours, wrote the grant, got the funding, and created our program, and maybe she could get you pointed in the right direction.
Okay, that would be wonderful.
I'll send you her email.
Okay, thank you.
Great. Any other thoughts or reflections on that one before we move on? And again, others on the call, feel free to chime in if you have thoughts for Marty. Emily, your hand is up. Go ahead.
Hi. I guess what I've got to say is a little bit, it's slightly tangent, but it's applicable. Sure. I recently went to a meeting for volunteers of the Vermont section of AARP. Here's my mug. Basically, the meeting that they had was at the Last Cup Cafe, which is a lovely place, but I had to carry my walker up the stairs in order to get in. And somebody who is less able to do that would definitely have a hard time participating in the meeting. And I just wanted to mention that it's exciting a lot. There's a lot of things in the events calendar on Facebook that I find, and I'm like, well, I would really be interested in that, but maybe it's something that is too late or something else. But I'm just suggesting that if there is disability accessibility to the events and the activities that you have going on, when you put the word out, that would be great information for people that might want to not get there and have to carry their walker up the stairs.
Yeah, thanks, Emily. I saw a hand from Pam. You had a comment on that?
Yeah. So one of the things that I would encourage organizations to do is to in planning events like these, or planning your front porch forum post about your event, or in your marketing, to take a broad view of what it means to be accessible. So sometimes the place might just say ADA accessible, but that doesn't necessarily mean that the parking lot is near the door. Or so feedback like, there's an elevator, you're going to need to go over uneven terrain, it's on pavement. Things like, we've got childcare available. Childcare is a huge accessibility issue for folks. We have a working elevator, or, oh, we have an elevator, but oh, it's not working right now. Things like those it's so important to have a nuanced sense of what have we got to work with around how can we make things as accessible as possible? Can we use, is there technology we can bring in that can quickly make things easier for folks who are hard of hearing? Is there stuff we can bring in? So if we've got an evening event, can we have food available so that someone who is working until 7 o'clock has an opportunity to get a snack, or get ideally some high quality nutritious food before they sit through a class or a meeting? Like, how can we play around with what we're able to offer our participants, and what kind of insights we're able to offer them about the kind of event that we're going to have, so that they know if they're able to participate or not. So the example of saying, like, I'm going to hold fiber classes with Leslie Roth. They'll be on the first floor of the library. There is an elevator. We will have yarn and tools available for anyone who's never done this before. And it's right next to the children's section. So anyone who is looking for, can I do this? Can I swing this one? We're going to try to give all those little hints to help somebody who's trying to say, is this one I can do? Oh yeah, like, we've got that. And you don't have to have all this on your flyer, but within your organizational website, if you can add a little link to, here's an expanded description of what's available accessibility wise, to give people a sense of, here, is this something that I might be able to do? Because it doesn't feel good to show up to an event and then realize it's going to take most of your energy for the day just to get from the parking lot into the classroom, or you've shown up and then you realize that you don't have the tools you need, or there's nothing to eat or drink there, and so playing around with, like, how can we make it as easy as possible to be there. If it's hard to build social connections, folks aren't going to do it. So the more we can kind of hold a nurturing space for folks and think about, how would it be hard to get into this building? How would these instructions be challenging for somebody to make sense of? Can we have multiple ways that information is provided, whether it's written, verbal, visual, like playing around with all the different ways that we can make things as low bar to entry as possible for folks, I think is really important as we're imagining community wellness. Because if we don't, we're going to leave a lot of people behind.
Thanks so much, Pam. I appreciate that. I'm going to call on Heather. I need to step away for 1 second. I'm going to hand it over to my colleague Lauren here to call on folks. But Heather, you go ahead.
You're 100% right, Pam, and Emily, that's horrible. I'm sorry. As some of you may or may not know, the first floor of our well space building completely flooded in July, and it remains completely unusable and inaccessible. And that is where we used to hold all of our Wellness Wednesday stuff. So we've had to move it all upstairs. And to Pamela's point, we have changed our flyer and all of our marketing stuff. And even when I am on air talking about it on our local podcast or even our radio ads, it does very specifically say you can park in our lower lot or in the metered lot across the street, which is free after 5 o'clock at night. But if you have mobility issues, then the lot nearest the upstairs door is reserved for you, because we don't want people just parking close to the upstairs door if they don't need to, so that the people who do need to have a lot that is close to it. But that if you need help getting to that door, even from the lot that's closest to it, that you should call us so that we can come out and help you, because it is uneven and kind of a crummy lot. And the door is unfortunately on a slope. So there is an elevator up there, but you've got to get to it from the parking lot. So that is all on our flyer and heavily marketed, because it's just kind of a crummy location. And because the downstairs is gone, we don't have an easy way to get in anymore. So in theory, it would be accessible, but no, it's not. But we do make it clear, because you just have to. And if you don't, then you're not cool. That's all there is to it. It's not cool. People need to be able to get in.
Thanks, Heather. Yeah, absolutely. I don't see any other hands raised at the moment, but does anybody else have questions or ideas you want to share, or potentially resources that you're looking for help finding? Or do any of the panelists want to share anything else? I know we only asked you each a few questions, and
I wanted to, go ahead, Amy.
Sorry, oh, no. Very quickly, I'm going to put a link in the chat for you all that it's a self-care action plan. And it's just available for ideas, really practical ideas of how to take care of yourself as you're doing this work. And, I find even sometimes having it visible reminds me to do something for myself. So I'll post that for you all as just an additional resource if helpful.
Great. And I was wanted to invite some of you or all of you. We are looking for other communities to use our new Passport mobile application for hyperlocal passport in their areas. So we would let you use it for free. You could create a passport for a group as small as 5 people to 500 people, whatever you're interested in. So if you're interested in finding out even more of what that is, I'm going to put my email in the chat.
All right. Well, are there any last thoughts, or sorry if I missed anything while I stepped away for a moment, but any last thoughts from the panel or any other questions from folks before we wrap up? Well, I just want to take a moment to thank all of our panelists. This was a really wonderful and thoughtful conversation. Just appreciate you taking the time to share the work that you're doing around the country, around the state, in your own communities. We will, like I said before, we will share this recording with all of you. We will also share any resources that were shared in the chat. And feel free to check out our website, vtrural.org. There's a whole library of workshops there. That's where we're going to post the follow-up from this workshop as well. And stay in touch with us as we kind of roll out more workshops over the course of this year. We're always open to hearing you know, this topic came up because we heard from partners and we heard from communities that it was an important one. And so please let us know if there are things that you'd like to have a conversation about, and we're always open to adding things throughout the year. So just really appreciate all the work that you are all doing around the state and taking the time to share with us today. Thank you so much. We'll be in touch soon with follow-up.